Hi, Kevin Henry, the editor of Dental Assisting Digest, here today at the ADIA symposium in New Orleans, talking with my friend Linda Meeuwenberg. And she's got a few topics that she's presenting here at the meeting, and I thought it'd be good to kind of catch up with her and see. I know one of the things that you're talking about is communication.
Correct. Yes.
So talk about some of the things for the people who aren't going to be here.
Sure.
Some of the high
Actually,
points.
I'll be presenting that program this afternoon, and it's called Communication, Making It Work for You and Your Office.
Okay.
So within that topic, within the couple of hours that I have, we'll be talking about what is it that a patient really seeks from you as far as their communication needs, because often the provider's communication need is very different than what the patient's is. So I hope to diagram that for people today and let them see the importance of that and kind of put themselves in the place of the patient.
Okay. And I know we just got done with some lunch and learns,
Yes.
and you had a completely
Yes.
different.
Yes.
And
Yes.
so talk a little bit about that.
Yes, well, my colleague and I, Edie Gibson, have developed a course called Surviving and Thriving in Your Profession.
Okay.
In these difficult times right now with the economy, as well as a lot of the musculoskeletal issues that hygienists experience, and knowing that hygienists are now taking a career for the long term. It's not that they're going to work in hygiene a couple of years and then marry a dentist and then retire. We work, for 20, 30 years now in the profession. And so what can keep you impassioned, about dental hygiene? How might you use your skills in a different arena that you had never thought of before? So through a series of workshops and worksheets where they can start identifying some of those things, we can talk about maybe moving your management organizational skills into a different arena in maybe the administration part of the practice.
Okay.
Or going back to school and getting some additional skills to move into a different arena.
So in the topic that you're having this afternoon, maybe
Mhm.
what are some of the most common communication blunders or faux pas, or what are some things that maybe you see in some practices that should be improved upon or could be improved upon?
Well, probably the overall most important one would be that as providers, we're looking at task, time management, and efficiency as we're communicating with our patients. For instance, you're a new patient, I'm reviewing your medical history, my head is usually down, I'm in my analysis mode, looking at, okay, let's see, you reported that you have cardiac problems, you're on this medication, I'm looking at my PDR, and the patient's sitting there like this thinking, oh my God, I'm dying. I've just done an extra oral exam saying that I'm going to, check for any unusual lumps or bumps. What's the patient thinking? Lumps and bumps, the C word.
Well, sure.
And then all of a sudden I stop, and I'm recording. Hopefully, as Jane Weiner spoke about, I'm recording the data, and all I'm recording is really that this area was normal, but the patient doesn't know that.
Right.
So I'm in my task analysis mode and forgetting that there's a live human being attached
Sure.
to this. And the biggest thing in my research and through others' research is such a small thing, how patients respond to a smile on your face. And even with a mask on, your smile comes through your eyes. And we need to address that. We often want to get started in our task and our techniques and which instrument are we going to use here without having established it just takes a couple of minutes with some good eye contact, knee to knee, eye to eye with that patient before we start getting our task and getting on schedule.
Okay. Some good stuff.
Thank you.
Thanks. Well, I appreciate your time.
Thank you.
Thanks.